Good evening, everyone. Happy Tuesday. Um, Coming in with another installment of Medical Talk in Layman's Terms with Nurse Charlene. And I'm your host, Nurse Charlene. And tonight's topic is near and dear because I had a little experience with some of this stuff. And the topic is germs, bacteria, viruses or virus and contagious illnesses. So that's what I'm gonna do is break down a few of those things. Excuse me. Break down a few of those things to you, and let's see if we can all come out with an understanding and everything. So yes, before I do that, though, take a little peek at my board in the bag. I drew some fungus and some viruses and what they might look like under a microscope and some uh, different germs and bacteria. And then I got some stuff over here in this side and stuff. It's a bottle of hand sanitizer, a sink with some water for washing hands and stuff like that. And I'm gonna just break down a few things for you if you don't mind. That's what I'm here for and stuff. So definitely after I read my podcast disclaimer and everything, we'll go right in because I got a heavy load and I don't think I'll be able to finish it all, but I'm gonna get to the good parts and everything for you. So welcome on in, y'all. Come on in and everything. Let me put somebody on and everything. All right. I got to get all those little nervousness and twitches out and everything so I can get on down tonight for you and everything. So I'm going to just go ahead and start while everybody is kind of warming up, flipping, scrolling until they see my page and me going live right now and stuff. So I'll start with reading my podcast disclaimer. Welcome to Medical Talk in Layman's Terms with Nurse Charlene, where health and illness are broken down into simple, easy to understand conversations. This podcast is for educational and informational purposes only. While Nurse Charlene is a licensed registered nurse with extensive healthcare experience, shame on me, I do. Okay. The information shared here is not intended to replace professional medical advice, diagnosis, or treatment. Every person is different. What works for one individual may not work for another. Always consult your doctor, nurse practitioner, or qualified healthcare provider with any questions you may have regarding a medical condition or before making changes to your health, your medication, or your lifestyle. If you think you may have a medical emergency, call 911, please, and seek immediate medical attention because your life may depend on it. Oh, okay. It's in my room. Oh, sorry. um, and then also, where was I at? Yeah, medical attention. The views shared on this podcast are based on professional experience and general medical knowledge presented in layman's terms to help bridge the gap between healthcare and everyday understanding. By listening to this podcast, you acknowledge and agree that this is not a substitute for personalized medical care. No provider-patient relationship is established, and you are responsible for your own healthcare decisions. And remember, your body speaks. Your body's a snitch. Believe it. Listen to it. Respect it. And when in doubt, check it out with a medical professional. Okay. Thank you for tuning in and taking a step towards better health, understanding, and understanding of your health. Okay. So I read that and I read it over and over because it's helping me understand that even me, I can't go on to somebody's podcast or something and get my information and run with it because there's so many things out there and it's so many different things. You got to kind of look some of this stuff up and everything. But if you see something interesting like this podcast and everything, it's best to make sure that checking out the information. Does it fit? And it might not fit you at that particular time, but it might be something that you could just keep in your wheelhouse, keep in the back of your mind, because you may be able to help somebody else that doesn't know or can't get on this podcast or something like that. So you are, by watching it, you are my helper. You're going to spread the word. You're going to get it out there and everything. And it's so much. The human body is so vast. We could talk about the mind. We could talk about the body. We could talk about our spirits and, different things like that. And it's all a part of you, the amazing me and everything. So again, the topic is germs, bacteria, viruses, and contagious illnesses. So I'm gonna try not to bore you to death and everything while telling you what this stuff is. And it's so funny as I was studying it and getting it together and what I wanted to say and what I wanted to put down. It's a lot of this is stuff you already know, but you want to know, what is that antibacterial? What is an antibiotic? And everything. Well, I'm going to talk about that tonight, and hopefully I can get. Is it on, Rosie? Oh, okay. I'm like, please and stuff. But okay. So I don't see nothing here. I'm sorry, you guys. I'm just looking because it looked like it's a glitch or something. Okay. Hopefully it's not. I'll hope you there and stuff. Anybody that's out there and stuff, you come on in. Okay. So my opening is, have you ever wondered what exactly is a germ? Or is every germ dangerous? Or what's the difference between bacteria and a virus? Or why don't antibiotics work on viruses? It could be, does hand sanitizer kill germs and different things like that? Or when are you actually contagious? I want to know that and everything. And all these things and stuff I'm going to try to answer tonight, if I could do that. Welcome on in, Auntie Josie. I don't know why it's not showing me anything, but okay. Say hi to me if you can. And stuff. But yes, so we're talking about germs, bacteria, viruses, and contagious illnesses. And I'm just going to break down a lot of it and stuff and see how far we can get on acknowledging all this stuff behind my head. They're not just squiggly lines. I actually, was drawing fungus and drawing viruses and drawing all the different things. And so today we're breaking all of it down. And it goes like this. What is a germ? Okay. So a germ is a tiny organism or infectious agent that can potentially make you sick. And then it's some germs are harmless. Some germs are harmless, because if we were just germless altogether and stuff, when something really hit, it would probably kill us and everything. So some germs are harmless and others can cause the infection. Some of the major types of germs are your bacterial germs, your viral germs, your fungus or fungi or, germs. And there's the thing called parasites. Okay. And so I think I'm gonna just go straight on. Oh, yes, I like this. And examples. So a bacteria could mean strep throat. That's the example of a bacterial infection. Urinary tract infection. Some of them can be, are bacterial. That's why you get an antibiotic for it. And then anybody know a TB where they take that little needle and put that little juice under your arm and stuff? That's another one. It's called tuberculosis. Those are examples of a bacterial infection. So then there's viral things and some examples of a virus or viral infection would be the flu, influenza, the flu, COVID. Yes, COVID. Your common cold. Yes, your common cold. And also measles. Nobody really get those anymore, but they're still around. but we get vaccinations for a lot of that measles, mumps, and rubella when you were a child and everything. So that's where that comes from. Then you have fungal infections, and that would be like athlete's feet, guys or girls, and stuff. If you got feet, you could get athlete feet, and everything. And that's a fungal infection. Also, is ringworm, them little circle little rashes that you get, and they're usually in a ring, so they call it ringworm and everything. The kids get them and probably rub them off of themselves, scratch it, and then go scratch another kid and give that to them and stuff. And that's where that comes in at. And then also some yeast infections for the women. You guys know what a yeast infection is and stuff, but most of the time they're kind of fungal and stuff. So that's where that comes from. And then there's a such thing as parasites, and parasites are your stomach flu type things and stuff, like your intestinal infections in your intestines or your gut and everything. And then also one that's like from out of the country and stuff is a malaria. That's a parasite and everything. And that's why you have to get certain shots when you leave out of the country or out of United States to go to somewhere else and stuff. You need to have these shots and everything and stuff. And that's where that comes in at. Welcome on in, my dad, Raymond Buckner, and everything. Thank you for coming on in and everything. So remember, not everything microscopic is automatically harmful. Your body normally has billions of microorganisms living on and inside of you. Okay. So another thing is, what is bacteria? What is bacteria anyway? And everything. Oh, okay. Hello, Auntie Josie. She said, hello, everyone. She's checking in. All right. Come on in. We're talking about the germs and contagious stuff that nobody wants to have, but we all somehow get it and everything. So bacteria in layman's terms. Bacteria are tiny living organisms. Some bacteria are harmful or helpful, while others can cause a disease to happen. For example, bacteria normally live in your gut, inside of your mouth, on your skin, and in your intestinal tract and everything. These microorganisms can help perform normal body functions. The harmful bacteria can cause a strep throat, a urinary tract infection, pneumonia on your lungs, tuberculosis on your lungs. Some are foodborne illnesses, like when you say I got food poison, that's what a foodborne illness is. And then also skin infections. So that's what a bacteria sits on. And some of the examples, that's the ones I was giving you. Like naturally, the good part is that they live inside your gut and they get along just fine. They not bothering nobody, but they're helping the environment, inside of the body that you call you and everything, inside your gut, your mouth, your skin, and in your intestinal tract. So we got to have some. We just don't want more bad than good, not the bad that is unhelpful and cause all the fevers and all the pains and shakes and hospital stays and all of that stuff and everything. So then the next one is, what is a virus? Well, what is a virus? Okay. All right. A virus is a microscopic infection agent that must enter living cells to make more copies of itself. So it's an imposter. It knocks on the door and tries to get in. This is virus. It knocks on the door, and then one little weakened cell in your body, and it gets in, and then it talks to that cell and takes over, and then it scoots on over to another cell, unsuspecting, looking like a good cell. But really, once it latches on and the other cell the healthy cell gives it permission, then now it's in that one. It takes over and kills the healthy cell and makes it a garbage cell. And then they just keep on repeating, and there goes the infection. There goes all the stuff that they have to do to help keep you alive. Because if untested and unchecked, you will surely die. It's called sepsis. And then you really starting to push it and going downhill especially if you don't know the snitch on it. Think of a virus as an unwanted visitor that gets inside your body's cells and uses them to reproduce a lot of its garbage cells inside your healthy cells, and it knocks and knocks until it gets in, and then it takes over, and then it knocks and knocks, and it's greedy too, so it's going to try to keep on and keep on and keep on getting in there. And common viral illnesses are common cold, the flu, COVID-19, RSV, that's the one for the kids and stuff, respiratory syncytial virus, measles, chickenpox, and some forms of hepatitis. That's your liver, inflammation of your liver, but you got a hepatitis A, B, and C. And I think it's probably some more and stuff, but I know of A, B, and C, and they're semi-common and everything. So another thing that I wanted to remind you of is don't ask for an antibiotic just because you're sick. First, find out what's making you sick. So don't just try to look for, y'all can't give me some amoxicillin. I need this to go away so I can go back to work or something like that. No, you don't just take it like you're taking Robitussin or something. By the way, Robitussin doesn't heal whatever you're taking it for. It helps eliminate some of your crybabies that we call the snitches, like that fever or that cough or that sore throat and everything. It relieves some of that, or that phlegm in your chest and everything. It relieves it, but it doesn't heal it the correct way. I'll tell you later and everything. So then what does contagious mean? So I told you bacterial. I told you viral. Now I'm going to tell you what contagious means, or what they're trying to say it means and stuff. And that is contagious means an illness can spread from one person to another. Transmission can occur through these steps. Direct contact, that's touching an infected person. That's one way of getting something being contagious. Okay, ask Brittany to put it on. She'll do it. Thank you. And stuff. So one is direct contact, and then one is respiratory droplets, and that's coughing or sneezing, and the particles can, you can end up coming in contact with the particles, and then that's how you get it. That's another way of being contagious. And then there's respiratory droplets, and I said respiratory, airborne transmissions, and that is when that germ that you sneeze stays airborne for a while and stuff, and then that person walking in and just walks right into it, and stuff, and then now they're sick as the person that just sneezed or coughed and that got all over the place. But it's when it goes airborne, that would be your TB type things also. And then contaminated surfaces. And so I did take the time to think about this, and contaminated surfaces is like that shopping cart. You going to make, do your grocery shopping and everything, and you're pushing the little cart in, but the person that had it before you was sick and contagious. And they didn't and sniff and their mouth and wipe their nose with their hand and stuff, and they put it right on that shopping cart handle. And then you walk in, you're unsuspecting, you didn't see that happening. Oh yes, thank you. Yes, you gonna do that? Okay, thank you. Okay, so sorry about that, you guys and stuff. It's life. This is live. live and everything. But that shopping cart, you putting your hands on it, right? And then something gets in your eye. It doesn't matter who it is shopping, something gets in your eye. The next thing you know, you rubbing your eye with that same dirty hand that touched the same cart, handle that contagious person touched before you. You didn't see them with all this, all their germs and everything and stuff. You just got to know that's why they have those little wipes at the store. When you first come in, you wipe the basket and stuff, and it doesn't always work. But guess who else gets it? The babies. So the baby is sitting there, and they're sitting in that little seat in the front inside the cart and stuff, and you're pushing the cart, and they're touching on that, and somebody sick was touching on it too. They might even take their little mouth and rub it up against the card or something like that. And you like, what are you doing? You know, and stuff. And that's where that comes from and everything. Then you got food and water contaminants. So that's another way that you could get sick, you know, and that's where stomach flu or mainly stomach flu or food poisoning. That's it. I had to think about that. But food poisoning and stuff, and that's spread through contaminated food or water. Yes. And everything. And then there's bodily fluid. Everybody knows that blood, poop or pee or throw up and stuff can be contagious. Not only just yucky, but contagious and everything. And so that's where that comes in at. And contagious doesn't mean that everyone will catch it, but you got a good chance of, if you come down with something suddenly after going here or going there and stuff, then you could probably bet on you came in contact with somebody that was out when they should have been at home taking care of themselves and everything. Oh, okay. Your risk depends on factors such as the type of germ, how contagious it could be, you know, and how much in trouble you could be, the amount of exposure, how the infections spreads, vaccinations and immunity, personal health, you know, and everything, personal hygiene, your environment, you know, and if you're unhoused as opposed to housed, you know, the unhoused, they could get just as sick as the people that have a housing and everything. You might have an underlying condition and everything, but all these things are factors for you catching something contagious from somebody else and everything. So then another thing is, what is hand sanitizer? Hand sanitizer is a product designed to produce or reduce or kill many germs on your hands. And it says for the CDC recommends an alcohol-based hand sanitizer containing at least 60%. You can get 70 at the dollar store and 91 if you're lucky enough to be able to look, you know, and that might be at your local drugstores like the CVS, Walgreens, whatever, and stuff. They will have something like that, like 91%. And you can put that in, mix that in with your hand sanitizer. If it's less than, you know, 60%, or, you know, just add a little to it and everything to make it a little bit stronger, especially when you are not going to be around a sink with running water and soap and stuff like that. That's where you want to go with that. Sanitizer has its limitations. And it isn't the best choice when your hands are visibly dirty. Like if you're a mechanic working on a car or something like that, you got to get on in there with some good old fashioned soap and scrub your hands in, you know, and everything, if you really want to get your hands clean and everything. Also, with greasy stuff, with contaminated things, you want to really wash your hands good, because they could slip into little slits in your fingers and stuff like that, and there goes you in trouble. You know, you got to get something or work something out. You got to tell on it so that you could get the proper treatment for it. And then you got hand washing, and it helps physically remove germs from your hands. The basic steps for hand washing is wet your hands, apply soap, rub your hands together, clean your palms. So you clean your palm, then you rubbing your fingers together, and you rubbing on the back, and you rubbing on the, you know, each back, and you rubbing in that inside and everything. But you need to do all those things in order to make sure that you're cleaning your hands properly, because it's a proper way of doing it, and it needs to be at least 20 seconds when you're doing that. And then you rinse them and you dry them thoroughly, because that little bit of water that's still on there, that turns into bacteria. And so then your hands are dirty all over again. Auntie Josie, what did you say? You said I wear gloves on the BART, and oh yeah, you already know, but you probably found out too and stuff. She said I wear gloves on the BART and bus. So I won't be touching everything. I need to wear them in the store also. Yes. I wish more people would think of that, including me and everything. But that's really good and stuff that, yeah, you need to really get in there and stuff. And so when you're out, you have no way of knowing who touched whatever you're touching, you know, at the time. So you don't know that they did that, or they just threw up in the bathroom, or they just wiped themselves and then washed their hands and came back out, and you know, some fecal matter is on their hands or something like that. Poop matter is on their hands and stuff, because it's dangerous and everything. So it's an easy memory trick. How about this for washing hands? Wet them, soap them, scrub them, rinse them, and dry them. Just as simple as that. So it's wet them, soap them, scrub them, rinse them, and dry them and stuff. And that's good and everything. So then what does antibacterial mean? Well, antibacterial means it's designed to kill bacteria or slow the growth of it and everything. So the important part is there's a difference between antibacterial and antiviral. Antibacterial product targets bacteria. It does not automatically mean it kills viruses, meaning if it's something viral on your hands, you would probably be better off with some soap and water and prayer and stuff. But yes, and then what are antibiotics? This is another one. And everything is antibiotics are medicine used to treat certain bacterial infections. Examples include medicines such as amoxicillin, Keflex, azithromycin, or doxycycline. Now, you might not have heard of any of them, but somebody that you know has taken an antibiotic sometime in their life. And that's what antibiotics are for. And they're for bacterial infections, not viral infections. And what is it? Antibiotics do not treat common cold, which is a virus. It doesn't treat the flu. It doesn't treat viral sore throats or COVID. So it doesn't do anything for any of that ever and stuff. So just remember that antibiotics is not the answer, because if you take them the wrong way or you take them unnecessarily, you become resistant. And then that way they don't have any antibiotics for you, because you already took them for stuff that they weren't supposed to be taken for building up your resistance to them. So what might have helped you before with that ear infection or something like that, this time around, it might not help you if you take it more and not use it properly. So that's where that comes in at and stuff. But thank you. And then what else? What is antibiotic resistance? It means bacteria changes in ways that allow them to survive medicines that previously worked on them. You see what I'm saying? So what might have worked on that ear infection, now it's not going to work on that ear infection. You know, it's that bad. And think of it like the antibiotic isn't becoming weaker. It's not weak. It's the same dose. The bacteria are becoming harder to kill by it because you took it maybe unnecessarily. You kept a couple of your pills or something like that, and then you got a little sore throat. You hurried up and popped you a little antibiotic, and it felt like it made it go away, but it didn't. It just made your body more resistant. So now when you get an ear infection again or something like that, guess what? It ain't gonna work on it. You're gonna have to have something else, because it won't work, because it's already used to that one. So the bacteria gets stronger and harder to kill, and the antibiotic is just the same. It wants to kill what was normal, not what you did in between. If that makes sense, I don't know, but if that makes sense. Okay, so then we got some top common illnesses. So I'm just going to run through them instead of trying to read every single thing on them and everything. But one of the top illnesses, common illnesses from contagious and all of that, and bacteria, viral, and germs in general and stuff, is your common cold. and that's viral. Then you got your flu. That one's viral. And then you got COVID-19. We know that one's viral and hard to kill. It's hard to stay away. We don't even have a cure for it. Then you got strep throat. That one is bacterial, and you can get antibiotics for it. Okay. Then you got your urinary tract infections, and those are bacterial. And then also you got pneumonia. That one's also that's one of the lungs. And then you got your food poisoning, and you don't get nothing for that and everything. You just got to kind of throw it up and stay hydrated, and throw up and stay hydrated until it clears your body and clears your system. But your body will try to fight for you and everything. And then you got dehydration. That's a big one. I'm dehydrated right now. But anyway, dehydration. And when you're dehydrated, this one is important. So I want to say you got to watch for very little urination. Oh, I ain't peed all day long. That's a problem. You should have the feeling of wanting to pee, even if you held it or something like that, where you're not supposed to. But even if you held it and stuff, you should still be able to feel like you got to pee, and you should be able to pee. And if you can't and stuff, that's a problem. That's your body snitching. Also, dry mouth, dizziness, weakness, extreme thirst. That means you just can't get enough, and it still doesn't fix the problem. And then confusion. And confusion will mess you up. Is no, you're not being demented or something like that, or getting Alzheimer's and stuff. It means that you need to hydrate up. You need to start putting it in, packing in the fluids, not just drown yourself with fluid, but just put it in at a reasonable rate and everything. A bottle of water an hour, and everything. And that should help you come out of that. And that's where your your lips start sticking to your gums and all of that type of stuff. That's where that stuff comes from. It's a trip, but that's where it is. And then also you got your fungal infections. And I just want to go over this one because of the people that might have little kids and stuff. One is athlete's feet. That's a fungal infection. And then ringworm, that's the one I want to say for the kids and stuff, is the ringworm. That's where you come with a circular type infection on their skin or something. It could be on the belly or on the arm, because kids touch each other, scratch their little ringworm, and then it passed on to the other kid and stuff like that. It's like a diaper rash in a circle, for your arms and stuff like that. They could be on your leg, on your chest or stomach or something like that, depending on what touch what and everything. And it hurts and it itches. It itches a lot and everything. And they have antifungal medication for it, but no antibiotics. So that's the big deal. And then symptoms does not always tell you the cause. So this is really important, because sometimes a symptom could be like a cough, or a snitch could be like a cough. And it's not automatically, it got to be bacterial because it's a cough, and stuff. It could be something else. Also, there's the fever. It's not automatic that it'll be bacterial. It could be viral, and everything. So it's other things that can cause you to have a fever other than that and stuff. Same thing with strep throat. It's not automatically sore throat is not automatically strep throat or something like that. It could just be something else, and everything. So instead of just self-diagnosing yourself, the biggest thing you could do and the best thing you can do is go to the doctor and tell them, if that makes sense. Okay. And then we got when should you seek medical care? These are the things, and this goes across the board with anything I talk about and stuff. When should I seek the medical care? That's when you're having trouble breathing, that's a problem. If you're having severe chest pain or pressure on your chest and you just can't seem to catch your breath, that's a problem. new onset of confusion. I just can't think right. My head is messed up. I can't think straight. I think I'm stressed out. That's a problem. Blue or gray lips, something in the air is not getting inside of you and stuff, because you should never have blue lips or something, because that's for somebody that might have passed on, and if you're cyanotic or blue lips or gray lips or something like that, it's a problem. Severe dehydration, that's when you just can't even pick yourself up or lay yourself down properly. You just drop and everything. So that's a problem. Rapid or worsening illness, like it didn't doubled up and it came with some friends. Now you just had a headache. Now you got a headache and a fever. Now you got a fever and swollen glands, and stuff like that. That's when yes, it's leveling up on you. It's definitely leveling up. And then your body's defense system. Your body has its own security system. Think of your immune system as security, your bodyguard. It works to recognize and fight harmful organisms. Your defenses include your skin. That's your security. Your mucous membranes, that's the inside of your mouth, your gums and all of that stuff, all the way up in your nose and stuff, your sinuses and stuff, that pink mucus area and stuff like that. Those are examples of your mucus areas. Your nose, because it traps particles, inside your nose and stuff like that. And so your nose already has its own little defense mechanism right there. The coughs, when you cough, you're actually pulling at whatever's in there that went in there that probably shouldn't be there, or that's irritating that to make you cough. It's trying to save you, and stuff. So that cough is actually a helper. And then what else? Fevers are not just there to get you hot, or something like that and stuff. Fevers are they're trying to burn out an unwanted material. And they also alert your security system, which is your immune system, to go into fight mode and everything. And then you got these things called white blood cells. You have red blood cells, but you also have white blood cells and a whole bunch of cells in your body. But white blood cells that's your defense, your line of defense and your immune system. And they help recognize and fight the infections, whatever's causing the trouble on you and everything. So remember, your body often gives you clues that something isn't right. Your body may say, I'm tired. Something may be affecting your body. I'm coughing. Your respiratory system is reacting. I'm burning when I pee. Something may be wrong with your urinary system. I'm vomiting. Your digestive system is reacting. I'm short of breath. Pay attention. Nobody should be short of breath. Is somebody holding your nose and holding your mouth and stopping you from breathing? No. Yeah. So something's wrong. Pay attention. And I'm confused. Don't ignore it. If you confuse and stuff, it could be more than just stress. It could be something else that's happening in your body or building up in your body. You got to be ready for it and everything. So then your symptoms are your body's notification system. Don't ignore the notifications. Please don't ignore them, because that's the difference between you being still here with us or leaving, unalive and everything. So going on to, we talked about the hand sanitizers and the soaps and all of that stuff. Okay, another thing, easy way to remember bacteria. B is for bacteria or microorganisms. A, so I'm doing the letters as an acronym thing and stuff. So B was the bacteria or microorganisms. A is antibiotics, target certain bacteria. C is contagious, means capable of spreading. T means transmission can happen in different ways, the route that it takes and everything. Then E is examine symptoms and warning signs. Pay attention. That's all it's saying. R is respiratory infections are often viral, meaning they don't have antibiotics for them. I is infections require appropriate evaluation so that they know what they're fighting. So that's when they get the blood test, they get the P test, they get all of that stuff. And that's the reason why they do it. And then A is antimicrobial products aren't always the same, meaning just because it says it's antimicrobial and stuff, it might fight this little thing right here, but it's trying to say it like it fights everything. It doesn't. So just remember that, even with the hand sanitizers, because if they don't have over 60% alcohol base on them, they're going to be a problem. Definitely going to be a problem. Yes. Welcome on in, cousin. Yes. And then what else did I want to say? What you can do at home to keep from keep alive while having a germ, a bacteria, a virus, or some type of contagious illness. And these are some of the things: drinking appropriate amounts, hydrating, period, hydrating, getting enough rest. Welcome on in, cousin Antoinette. She said, "Hey, cuz, it's Tony. I'm here. I'm sorry, it's everybody's listening." Hey, checking in. Oh, thank you. I welcome on in, dear. It doesn't matter and stuff. I'm talking about germs, the things that we see every day. We might have them on us right now as we all talking and going back and forth and stuff. So it is what it is, but we're going to learn about them so that we know what we're going to do about them and stuff. I don't know about everybody else. They got to see this and everything. So what can you do at home to kind of protect yourself? So stay hydrated. That'll help you. Getting adequate rest, getting that 7 to 8 hours rest. If you get too much is the problem, but if you get just enough, you're good. Eating as tolerated, not just smacking down the whole city in one sitting and stuff, but eating until that urge to be hungry is gone and everything. And then practicing good hand hygiene. It's always soap and water first before anything else. If you're not able to get a hold to soap and water, then if you're carrying that hand sanitizer gel and everything, just as long as it has at least 60% alcohol inside of it. You could buy your own alcohol and add a little bit more and stuff of like 91% or 70% or something like that. But you want to be higher than lower, and never lower than 60%, or it's probably going to be a problem. It's no use doing it. You'll be better off with a bottle of water and just washing your hands under it and everything. Also, covering your cough and sneeze. I was told that instead of us going "Achoo" with them hands or "Achoo" like that and stuff, that you actually that one was good. The "Achoo" in here or the cough and stuff. And me, for years, I even went as far as usually I have one of my lab jackets on or something like that. I just go inside of it and cough. But remember, that's mine. And so then somebody else touch me or touch up against me, that could be a problem. But that's what I consider trying to respect it, and everything. Nobody wants you sneezing all over them shopping carts that you go and push around the store. And then I don't want to touch somebody else's boogers. I mean, do you? And stuff. So you know what I'm talking about and everything. So then there's monitoring systems, like monitoring for this, like, having that thermometer, having, those different things so that, that blood pressure cuff, don't sleep on them. I'm telling you, just having those things around can be the difference between you living and dying even, so getting that part and having the wherewithal to tell, snitch on it, your body snitching on you. Okay. And contacting your doctor. Call the doctor. Hey, I'm sick. You gonna call someone to the pharmacy, or am I coming in there with my mask on, but I'm gonna be coughing, I'm gonna be itching, and stuff like that. Just get it done, however that looks and stuff. So that's the biggest thing I could do to help out and everything. And so, when does a snitch become a warning? And some symptoms should never be brushed off. I can't breathe. You need to pay attention. I can't reiterate this enough, but I needed to do this and stuff. So I can't breathe. Pay attention. You should never have a blocked airway. What did you? Oh, cousin Tony said, yeah, I still wear a mask when I go into certain places. Sometimes I wear them to sleep. Do you? I heard that. She said sometimes I'll wear them to sleep and stuff. I know it's getting that bad that you feel like you need to like super protect yourself, but especially when you're on a public transportation and stuff like that. Those are some places, because everybody just sitting down. You don't know who was sitting in that seat before you, and then you get up and you somebody that's unkept and maybe unhoused even, or they could be housed, and stuff, and they sitting there and their fluids and bodily stuff, and then it dries up, but it's still on the seat or whatever and stuff. Then you sit down on there and stuff, and then you going home, you okay, you didn't feel nothing and stuff, you didn't probably smell it either, you may or may not have. You go home and you go sit in your bed. What you just brought to your bed? Your boyfriend, your girlfriend? Yeah, you just brought that germ to your bed. Yeah, take them shoes off. That's why it's good to take them shoes off at the door and stuff, and come on in. And then, if you got contaminated stuff, like me being a nurse and stuff, I'm gonna peel out of them scrubs. I'm not wearing that stuff, and then going to jump in my bed because I'm dead tired. You pull that stuff off and put you some house wear on, and everything. And actually the proper thing to do is to actually shower or bathe, take a bath or something like that, and then put on your night clothes. Now you ready for bed. Now you're gonna have a good sleep. Now you're gonna be comfortable, and you're gonna be what? Germ free. It doesn't matter the germ, the bacteria or virus or whatever, contagious, whatever, you'll be germ free. So don't bring the outside into the inside, into your dwelling, or y'all ain't never gonna get inside your household, and including my household, because I go to the same store as you. I go to Ross. I go to all the other little good stuff that everybody else go to and stuff. So I'm saying this to say that, yeah, ain't nobody sick up in Ross. They getting their little discounts and all of that stuff. Yes, they are. Where you think it come from? They might be going to get them some towels so they could take a bath, but they coughed on all the rest of them. You pick up you a couple towels with a little germ on it, and you take that to your house. That's why it's good to also wash your towels and wash your rugs or something. You buy a brand new rug or something like that and stuff. You got to wash that stuff. What'd you say, Auntie Josie? Let me see. She said, when I go out on the BART and bus, I come home and take my clothes off and my shoes. I think you meant to say shoes, and I don't keep them germs on me. Absolutely. That's right and stuff. Auntie Josie was saying, when I get off, public transportation, the BART and the bus or whatever and stuff, when I get in the house, I take all that stuff off at the door. That coat stays by the door and stuff. Keep it somewhere where it can be aired out, because you might not be able to wash your coat every day and stuff. But hang that bad boy. Don't take it to your room, your little sanctuary, and stuff like that. But hang that, in a common place somewhere. Have them shoes off so you have the least amount of germs and stuff. And then that, never go to bed with that dirt on you, that outside dirt, and stuff. And if it's inside dirt and stuff, that might be for you, and stuff. So if it's your own inside dirt and stuff, you might not get sick off of it. But that outside dirt mixing with your inside dirt, you might be in trouble and right out of luck. And I'm just saying that because it seems minor, but it's so serious stuff. So these things, we got to pay attention. That's all I'm saying. And then also another thing is when it becomes a warning that you need to help yourself and stuff is my chest hurts. Pay attention. That could be a heart attack. It could just be heartburn. It could be, anything, but just pay attention to it. Are you getting any other symptoms? Because it might be that heart attack or something. Then you got, I'm confused. Pay attention. When you in your right mind any other time? So if you're starting to get confused, then you're starting to get something. I don't know what it is. The doctors don't even know what it is and stuff. It's just you got to get there. Then tell them. Don't be scared to tell them that, I kissed somebody or something and I think I got this or I got that and stuff. Tell them. So you don't have to pay attention to them and let you go into the doctor. Y'all don't in the same circle. So tell on yourself and everything. It's going to be all right. And then another one is I can't keep fluids down. If you're vomiting, if you don't get out of your house and go on and not live by the toilet and stuff, that's a problem. That's an absolute problem. So things like that, definitely just pay attention. And I can't keep fluids down. Come on, you got to go. You're going to be dehydrated before you even get a chance to fully die, and everything. And then there's I'm getting much worse. Yes, because you sitting there and watch them. What you found out that you could just take a gummy and that was the end of it. And no, it starts leveling up on you. It starts elevating on you and stuff. It's a new level, and everything. You down here still talking about, oh, it's just a little headache. Oh, it's just a little fever. It'll go away. I took some Tylenol. Why did you get it in the first place? You see what I'm saying? So yeah, Tylenol doesn't heal, or any of the Advils, Motrin. They don't heal you. They treat a snitch. They stop that one from whispering to you. And if you keep on ignoring all of them and stuff, if you put them all together and you see, oh, I got 5 symptoms, yeah, you're probably in trouble by the time you figure out that you got that many, or you might not even know because, yeah, you're already too confused to even figure it out and everything. So that's where that comes in at and everything. So, you guys, I'm going to end early. Yes. And everything, but, never ignore severe symptoms and everything. And remember these 7 things. Germs are not all the same. Okay. Bacteria and viruses are different. They're on 2 separate sides of the street and everything. Antibiotics treat bacterial infections, not viruses. If you have the stomach virus or the stomach flu or the coronavirus, COVID-19 virus, whatever they want to call it and stuff, that's a virus. And antibiotics can do anything to reduce that for you. Even if you took them, you thought you felt better, you didn't do anything. You gotta follow the protocol for that, whatever that sickness is, by telling, so that you and somebody else that actually is responsible enough knows that that's happening with you. And then hand washing is one of the simplest ways to reduce the spread of infection. And sanitizer is useful when soap and water aren't available, but it has limitations. And contagious illnesses can spread in different ways. Your symptoms are clues. Listen to them. All right, I'm gonna find out who that is. They're gonna be in trouble and stuff. So powerful conclusion. Oh, Auntie Josie, you said sometimes when you call the doctor, they don't want to see you and just want to order you medications over the phone without looking to see what the real problem is. When that happens, your best out is forget your doctor, go to the emergency room or urgent care facility, because sometimes that impending doom, that if you're really, really sick and stuff, that impending doom type thing that's going on. And so if If your doctor seems like nonchalant, oh, just take this, I'll give you this, and you go pick it up at Walgreens, and that's that. But you like, I feel horrible. I gotta throw up. I had the number three, or I think that's poop and pee made number three or something like that. Diarrhea, and stuff like that. This is happening to me. I'm dizzy. My eyes are blurry and stuff. Yes, something is going on. And if they want to see you over the phone and they don't want to see you in person or nothing, go to the hospital. Because they probably don't want you there at their office, because then all the people could get sick or something like that. But I would go to the hospital because they don't have enough equipment. They can't take you in the back, especially if you got a little facility and stuff. They can't take you and do no x-rays on you. You got to go to the hospital anyway and stuff. So that's when it elicits the urgent care or something like that. Never just trust that alone. If they don't even want to see you and they just want to talk over the phone, forget that. Forget that. I'm telling you, it ain't gonna help you, and it might even end up making it worse and take your life, perhaps. And then Cousin Tony said, as always, cuz you're the best. Keep feeding us that knowledge. Great job tonight. Sorry I was late. Oh, no, it's not sorry you was late, but we could have did more back and forth and stuff. That's the only thing we missed and everything. But that's all right. You watch the replay because, and stuff, because it'll help. And even if it's not you with this problem or, germs or no, all of us got germs and all of that stuff. But even if it's not you, you can help someone else, and everything. So no worries and no foul and everything. So I'm just going to read the powerful conclusion. I think I had said I had 7. So one more. 6 is contagious illnesses can spread in different ways. And 7 is your symptoms are clues. Listen to them. I'm throwing up. That's a snitch. I got a fever. That's a snitch. I'm in pain. That's a snitch. My throat is sore. That's it snitching. My nose is stopped up. That's a snitch or a symptom. A symptom or a snitch or a symptom. So that's what that comes in at. So the conclusion, and then good night to y'all and stuff right at 8:00. And that is, we can't see most germs. We can't always tell whether an illness is bacterial or viral just by looking at someone. And sometimes the symptoms seem small at first, and then they level up. But your body is constantly communicating with you. A cough, a fever, a change in your breathing, unusual fatigue, being extra tired, pain, vomiting, diarrhea, burning with urination, confusion. These aren't just random events. They're clues. Your body is saying, hey, something is going on here. So don't ignore the message. Don't automatically reach for the antibiotics. Don't assume every infection is the same. Don't wait until a small problem becomes a big problem. Learn your body. Protect your health. Okay, almost done. Wash your hands. Know the difference between bacteria and viruses. Use medications appropriately as they say on the thing. Don't make up your own because you'll end up messing it up and stuff. So just do it on your own and stuff. Pay attention to that. Know when to call your doctor. Know when to go into the urgent care or ER if you have to. Your body's a snitch, believe it. Medical talk in layman's terms with Nurse Charlene, breaking healthcare down one bite-sized piece at a time, because understanding your health can help you make better decisions about your health. Okay, you guys? I hope that got in there and stuff, and definitely I'll be coming with more stuff, but these are things that we need to know. So pay attention to that board. watch the replay about 3 minutes after I get off live and everything. You'll be able to find it, and then go to the parts that you didn't catch or something, or if you want to hear another part over again. I thank you for everyone that got on and took a little time out of your evening to talk to me on a Tuesday and just keep me company and everything while I talk about some type of medical stuff and everything. But I appreciate you, and you guys take care of yourself. You only get one you. Your family only gets one of them. Your kids, you want to take care of them. You want to take care of your family. You want to do what's right for that neighbor, that person, that churchgoer, that, whoever it is and stuff. You want to make sure they're taking care of themselves. If you notice a gap, go ahead and fill it in and everything. But thank you all, and y'all stay blessed, and we got this. We got this, one illness at a time. Okay. Thank you guys for tuning in.